Okay, for this video, I will be talking about atypical Parkinson's or secondary Parkinson's or Parkinsonism, and all these words actually refer to the same thing, which is a condition that looks like Parkinson's disease, but it's not Parkinson's disease. And how this typically happens, right? So in previous videos, we have spoken about how is it that we as doctors arrive to a diagnosis of Parkinson's disease, and we have this terminology and the mnemonic, right? The TRAP mnemonic, the tremor, rigidity, akinesia, and postural instability problems. And not only people with Parkinson's disease will have the symptoms. There will be people having other neurological conditions that will have similar symptoms, but it is not exactly Parkinson's disease. So now we're talking about the secondary Parkinsonism or the Parkinson's plus or the Parkinsonism patients, right? So what are these conditions? How or why they are different from Parkinson's disease? So in the past, we discussed that people with Parkinson's have a range of symptoms that typically are responsive to levodopa or dopaminergic medicine. So that is probably the main characteristic that we see in people with Parkinson's disease. However, people with secondary Parkinsonism typically do not show that robust benefit to levodopa or the medicines that we typically use for the care of people with Parkinson's disease, right? So what are these conditions? So in first place, one of the main conditions that are considered Parkinsonism or atypical Parkinson's is Lewy body disease. Lewy body disease looks very much like Parkinson's disease. However, people with this condition typically have hallucinations even early in their diagnosis, and also they seem to have these fluctuations in mental status that is quite characteristic of Lewy body. The other condition is MSA or multiple system atrophy, and MSA is a little bit complicated because it comes in three different ways, right? The same neurological condition presenting in three different manners: the Parkinsonian type, the autonomic type, and then the last one is the cerebellar type. These people have many or a lot of unsteadiness and difficulty coordinating movements. The next condition is progressive supranuclear palsy. These patients present with frequent falls, even early in their condition. Corticobasal degeneration, which initially might look very similar to Parkinson's disease because it is very asymmetric. Always one side is more affected than the other side. However, besides the Parkinsonian symptoms, there is some cortical dysfunction. And by this, I mean difficulty with coordinating certain movements that are characteristic of these conditions. The other type of Parkinsonism, which is very important that people learn about this, is drug-induced Parkinsonism, right? And drug-induced Parkinsonism, just like the name says, is that some people might be taking a medicine that is causing a pseudo-Parkinsonian state. And many times, taking the patient off that medicine will be able to improve or relieve the symptoms of Parkinsonism. And then the other type is a vascular Parkinsonism. This is typically seen in people that have a history of multiple strokes or slowly progressive microvascular ischemic disease. So this is something that your doctor will be able to do multiple evaluations, including an MRI of the brain, in order to be able to reach the final diagnosis. I really expect that you find this information to be helpful and that it helps clear some of the doubts that you or your family members might be having. Obviously, it is very important that you see your neurologist or your movement disorder specialist in order to discuss this in detail and being able to arrive to what seems to be the real diagnosis. This process can be very difficult, let me tell you. And even for a movement disorder specialist, it might take multiple evaluations in order to arrive to that final diagnosis. Fortunately, we have better technology today compared to even 2 years ago. So we feel that we are in the position to make this diagnosis more accurate. Thank you for your attention. I really hope that you find this information to be useful, and do not hesitate to reach us in our clinic or share your email with us so we can share new information with you in the future. Thank you.